Cervical cancer was once known to be one of the most common causes of cancer-related deaths. But over the last 40 years, the cervical cancer death rates has decreased by more than 50%. And the main reason for this change was the increased use of the Pap test. Some might still question, what is cervical carcinoma? Well, cervical carcinoma is the cancer of the cervix, which is located at the opening of the uterus as shown here. It is almost entirely preventable with regular screening and an appropriate timely follow-up of abnormal results and HPV immunization. But what is cervical screening? Well, cervical screening is used to find changes in the cells of the cervix that may lead to cancer. These cells are known as precancer cells. There are 7 screening methods that can be used to diagnose cervical cancer: Pap smear, colposcopy, HPV DNA testing, endocervical curettage, ectocervical biopsy, cone biopsy. Let's start with what is a Pap smear. Pap smear was first discovered by George Papanicolaou. This is one of the most major screenings required for the diagnosis of cervical cancer. Pap smear is divided into 2 types of testing methods, which are conventional method and liquid cytology method. So, what happens during a Pap smear? Well, during this routine procedure, the cells from your cervix are gently scraped away and then examined for abnormal growth that may suggest the presence of precancer cells. How often do you need to do a Pap smear for prevention? Starting at the age of 21, continue every 3 years, and then from 30 to 65 years, every 3 to 5 years. That is, only if your previous Pap test and HPV testing results are negative. Lastly, from 65 years and older, you may not need any more Pap smears. However, consult your doctor depending on your further requirements. Now, let's move on to what is colposcopy. This screening method is a way for your doctor to use a special magnifying device to look at your vulva, vagina, and cervix. The device used to aid in holding the vagina open is known as a speculum. So why is colposcopy done? It is used to look at the cervix for abnormal areas when Pap test results were abnormal 3 consecutive times. Furthermore, to look at the cervix for abnormality if an HPV test showed a high-risk result, which may develop into cancer. In addition, if an abnormal tissue is found, a sample is usually taken, which is then sent to the lab for a more detailed investigation. And who will need further treatment? Treatment is recommended if results show cervical intraepithelial neoplasm, also referred to as precancerous cells. CIN is further divided into 3 types. CIN-1, slight changes seen on epithelial cells. CIN-2, moderate changes seen on epithelial cells. CIN-3, severe changes seen on epithelial cells. Next, we will look at what is HPV DNA testing. An HPV test looks for some high-risk types of human papillomavirus. This includes types 16 and 18, which cause most cases of cervical cancer. The HPV test is most often used alongside the Pap smear in females aged 30 or older, in which doctors may use the same sample of cells for both the tests, or they may use 2 different samples instead. Nevertheless, when the Pap smear is unclear or slightly abnormal, this test may be used to see if HPV is present and whether the patient may need further examinations or treatment. Follow-up of HPV testing. If in case the Pap test results are normal but the HPV DNA test results are abnormal, the approaches are either repeat the co-testing of Pap smear and HPV DNA, or test for HPV type 16 or 18. If positive, colposcopy is recommended. If negative, repeat co-testing. So, what are the benefits of HPV and PAP co-testing? For women 30 years and older, this test is the most accurate test for detecting cervical carcinoma, since it may not miss any abnormalities, thus decreasing the chance of false negative results. Therefore, if the test results in a negative for both pap smear as well as HPV, then this determines that the individual may not have cancer for the next several years. Now let's look at what is an endocervical curettage. This is a procedure in which the mucous membrane of the cervical canal is scraped out using a spoon-shaped object known as a curette. This procedure is needed for testing any abnormal cell histology that might have been missed by pap smear and HPV testing. But what should you expect after a biopsy? Some women can experience some mild symptoms following a procedure, such as cramps, vaginal bleeding, spotting, and a dark discharge. Next up, ectocervical biopsy, which is the removal of tissue from the ectocervix for a detailed microscopic investigation. This procedure is done using the same visualization tool of colposcopy, through which they can also acquire a tissue for biopsy using the Ishler biopsy forceps. And last but not least, what is a cone biopsy? This procedure is where the doctor removes a cone-shaped piece of tissue from the cervix, also known as conization. The cone-shaped area is also known as a transformation zone. In other words, it is the area where the abnormal precancerous cells may first appear. Some cone biopsies can be used to completely remove the early cancer cells, also known as precancer cells. There are two methods for performing a cone biopsy: the LEAP, otherwise known as loop electrosurgical excision procedure, or cold knife cone biopsy. Firstly, in the loop electrosurgical excision procedure, the tissue is removed with the electrically heated thin wire loop, which acts as a small knife. Local anesthetics can be used. Secondly, the cold knife cone biopsy uses a surgical scalpel or a laser to remove the tissue instead of a heated wire. During this procedure, you will require anesthetics, which can be either general anesthesia or spinal epidural anesthesia.
هيا بنا نلخص ما تعلمناه. سرطان عنق الرحم هو السرطان الذي يصيب منطقة عنق الرحم والتي تقع في الجزء الأسفل من الرحم وتربط ما بين الرحم والمهبل. لفحص عنق الرحم تستخدم عدة طرق للكشف عن التغيرات في خلايا عنق الرحم والتي قد تشير إلى احتمال تطورها إلى خلايا سرطانية. هذه الطرق تشمل مسحة عنق الرحم، التنظير المهبلي، اختبار الحمض النووي لفيروس الورم الحليمي البشري، عملية الكحت أو الكشط، عملية أخذ خزعة من الطبقة الخارجية لخلايا عنق الرحم والخزعة المخروطية. مسحة عنق الرحم وهو الفحص الأكثر استعمالا والأكثر أهمية، والذي يتم إجراؤه إما عن طريق تلطيخ العينات على شريحة زجاجية أو فحص الخلايا القائم على استخدام سائل لحفظ العينة. التنظير المهبلي وهو إجراء تشخيصي طبي يستخدم لفحص صورة مكبرة ومضاءة لعنق الرحم وأنسجة المهبل. اختبار الحمض النووي لفيروس الورم الحليمي البشري، والذي يهدف لتحديد نوع الفيروس، خاصة النوع 16 والنوع 18 المرتبط بسرطان عنق الرحم. عملية الكشط أو الكحت وهو إجراء يتم القيام به بإزالة جزء من بطانة الرحم عن طريق الكشط أو الكحت للكشف عن وجود أي خلايا غير طبيعية. عملية أخذ عينة من الطبقة الخارجية لخلايا عنق الرحم، يهدف هذا الفحص إلى أخذ عينة من الجزء الأسفل من عنق الرحم وفحصها مجهريا. عملية أخذ عينة من الطبقة الخارجية لخلايا عنق الرحم، يهدف هذا الفحص إلى أخذ عينة من الجزء الأسفل من عنق الرحم وفحصها مجهريا.